we'll just take like a 1-minute break, and if you want to get a drink, or if you got what you came for, that's great. Or we'll have time for some questions. And so that's kind of how it's going to go. And I just want to also kind of introduce ourselves. This is
Dr. Martins.
I'm Dr. Bircher. And also, I'm a chiropractor. We're both chiropractors. We deal with people with Lyme's. We don't claim to be Lyme's experts, but we deal with people with Lyme's all the time. I see people literally every day who have Lyme's or have had that. And what our role in the healthcare scheme is, what I think of is, in the old days, would be more of a general practitioner. And if we find somebody who has something that we can't handle, we recommend that they refer them to a specialist. So we don't try to take all people with all things, because we don't know everything. But we do know a lot, and we have a lot of experience with Lyme's, and we have protocols that we have used that are very effective, and we wanted to share those to offer to find out what is the cause of your problem, so you can do something to improve level of function. And our training is in functional medicine. I'm a member of the Institute of Functional Medicine. We have training in functional medicine. We have training in functional neurology. And as most people would say, Lyme's does affect your nervous system also. So that combination is a good combination to be able to treat a lot of those symptoms.
Yeah, no, that's about it. Yeah, like I said, American Functional Neurology Institute, and certified in nutrition and nutraceuticals and things like that too.
So we just kind of want to get the state things out of the way. We're certified by the state of Wisconsin to be able to treat people with nutritional therapy for Lyme's or any condition, really. So I just wanted to make sure that you understand who we are and where we're coming from. And just kind of a little background. I've been doing this for 35 years. Started treating people with Lyme's a long time ago. And I think just a quick story, the first person that I treated with Lyme's was a lady from over by Baldwin who was a nurse. And she had Lyme's and was off work, and she tried the antibiotics, a few rounds of Cipro, a few rounds of this, and didn't really get anywhere. So she tried some IV antibiotics. She worked in a hospital, so she did some in-hospital IV antibiotics, felt some better, but it didn't really correct it. She eventually came to see me. We did some nutritional things. She felt better, but didn't correct it. And so she said, in her nurse's training, in her logical mind, she said, would you be willing to do the same or similar protocol on me if I'm taking the IV antibiotics at the same time? And I said, of course I would. I'm not against medicine. If whatever works and doesn't have side effects, I'm for it. So she set it up with somebody at her hospital to do the IV antibiotics, and then she came to see me at the same time, and we did that, and she corrected it and cleared it up completely, went back to work, and has been fine since. So that was my first case with Lyme's 25 years ago. So it's, and you'll hear a lot of stories about, well, I had it, test said yes, treated a few times, and test said no. One of the things I want to, we'll get into why it's so confusing after we just give, just a little background of what Lyme disease is and just a little history of it.
So I think most people know that Lyme disease it's basically bacteria spread by the deer tick. I'll leave out all the big Latin words with all this. So it's in 20% of people that get infected. It's somewhat permanent. Again, we'll get into maybe talking about why that is later, because again, it can be a little complicated. Most people, it's most common vector-borne disease in the United States, so it's very popular, and it started in the United States. I don't know how many people know the story behind it, but it started in the United States. Once bitten, again, the blood-brain barrier is affected. So that's you know, like a little tissue. Everyone's heard of like leaky gut or gut permeability issue. It's kind of similar to that, like leaky brain. So, and then it can affect again your central nervous system a lot easier, because brain is part of your central nervous system, is the main component for that. So, and then it can go throughout the rest of the nervous system also. So for up to 2 weeks, again, allowing into the brain tissue. So.
And when it says in there, it gets into the brain tissue, the actual Lyme's bug doesn't get into the brain. It's the chemicals from the Lyme's that gets into the brain. But it does affect neurological function.
Again, it's a very painless bite. I'm sure most people here, I've only met actually one person who said they've never been bit by a tick. So that was actually quite recently. Most people I know have probably been bit by a tick, and most people don't know that they're actually being bit by a tick until they feel a little buggered on them, you know. So this says again, fewer than 50% of patients with Lyme disease only recall being bit by a tick. And I've heard that statistic change a little bit. Only like 30% of the people out there who have Lyme disease ever even knew they were bit by a tick. One of the biggest misconceptions is that you get a bullseye rash. Again, that statistic's a little bit different too. Some people, you know, some studies show it's only about 25%, and up to about 50% of people who do get the Lyme disease will get that bullseye rash. So don't just bank on, oh, I didn't get a rash because when I was bit, so I don't have Lyme disease. It's not the way to go by figuring out whether you have it or not. So Lyme disease is not just in the United States anymore. Even though it started around here, it's been documented all over the world. And why is that? Well, just like any disease, it transfers on pets, animals, and again also with humans. So, you know, with people being able to travel across oceans, you know, these days it does travel, and it's been found in basically all over the world. It doesn't know any borders, and it doesn't distinguish, you know, people and stuff like that. So there's 5 different main subspecies of the main tick, and over 100 strains in the U.S. and 300 strains worldwide have been documented with it. And we'll talk about a few of those too. So, and one of the other more common ones that you're hearing about too now is the Lone Star tick, you know, from down south near Texas. That kind of started.
So the risk factors that people known tick bite, you know, season, most likely in the May through September, in wintertime they die off. Geography, there's areas where there's known to be a lot more ticks that carry it, and this area happens to be one of the high areas. You know, being outdoors, picking up ticks from pets, I've done that. Just being out in the woods. I've been pretty successful just keeping my lawn mowed well, keep the, you know, weeds away from where I am, and it works pretty well to keep ticks off of me. But kids pick up ticks easily. I have my 4-year-old granddaughter staying with us, and she likes to go other places that I don't always go, and likes to pick them up sometimes. So they're around, and most people, as he said, have been exposed. So that's something that most people around here are exposed to, and only part of them get Lyme's because only part of the bugs have Lyme's to transmit to you. Okay?
And repellents can be a big thing for preventing it too. You know, I don't know how many of you here, but I'm a big outdoorsman. I like to hunt, fish, and things like that, and I'm always going out to my woods to get my hunting area prepped and stuff like that. And the other week, you know, beginning of summer, I was walking through the brush. I didn't walk more than 10 yards, and I counted over 20 ticks stuck to my pants already. And you know, plucking those things up, and it's like, then you go another 10 yards, and you won't get a single one. So they're different. But I find like you do when you do use tick repellent, you know, again, it does prevent ticks from being as common on your clothing.
So just the normal stuff of trying to keep, you know, tuck your clothes in. DEET is one that works fairly well. You can see the permethrin you can put on your clothes. obviously look for them, remove them like he said. Long pants, just try to cover long sleeves. And the CDC says that 48 hours is the standard. If they're less than that, pull them off. Your likelihood of getting Lyme's is pretty slim. Greater than 48 hours, it starts to increase. And it can be transmitted other ways, mom to fetus, which was just discovered a few years ago. Breast milk carries them. And that's sad, but it happens. It goes through milk, blood donors. They also just found out lately that it can be transmitted sexually. So the bugs are active and like to move around in all kinds of ways. They're associated with Alzheimer's and autism. So they affect the nervous system, and so people who have those other issues, it tends to make them worse.
If you read here in the statistic, it says 15 states with the highest incidence of Lyme disease, 12 of those have the highest incidence of autism spectrum disorder. And so, you'll probably hear a lot of things through our talk, there's no necessarily always concrete evidence with some of this stuff, some of it's theories, but they're well accepted theories, okay?
So, and more information is being studied a lot more. You can look at, there's a website on the bottom of that slide, guidelines from the government. The U.S. government is finally spending some money researching Lyme and what to do about it. But it is a serious problem. It affects psychiatric issues, obviously they're listed there. Neurological issues, energy, you mentioned fatigue, that's a very common one. But there's, again, you have to look at all the studies because, unfortunately, there are groups of people and companies who have an issue they'd like to promote, do a small study and say, well, we have a study that says this. And then you see another one that says, okay, we have a study that says the opposite. And so when my mom sees that, she said, well, I'm just going to not look at it anymore because one study says the opposite of the other one, so obviously neither one of them know what they're talking about, I'm not going to look at it anymore. That's not a good idea because if you look at enough studies and you have 20 that say the same thing and one says something different, then obviously the 20 is the correct answer. So there are some unfortunately flawed studies out there, and they usually come from somebody who has something to sell or has some agenda. The symptoms, he mentioned the first and most common symptom, fatigue, skin rash, just shakes, and the list is there, you can read through that, but you've all heard of all those symptoms.
Fatigue and achy joints are probably going to be some of your most common, achy, stiff joints, fatigue, maybe some headache type things too, so. Here's just a picture of, again, the bullseye rash in different ways. Again, it doesn't necessarily even always have to be a bullseye rash. It can sometimes just be a rash. I just had a kid in here, 10 years old, and he had just a rash that went around his chest, similar to actually kind of that lower left picture, but it was around his chest. It wasn't a bullseye rash or anything, it was a rash. And so it didn't look like a Lyme rash or anything, Lyme's tick rash type of a thing, but that's kind of what it was.
And also, that doesn't have to be where the tick bite is. My son, I've never had Lyme myself, my son has, and he had a tick bite in the back of his neck, right at his collar line, and the rash was on his chest. The bullseye, he had a classic bullseye right in the middle of his chest. Why the tick there and the bullseye here? I don't know, but I've seen all kinds of variations.
And that was the same with this kid I was telling you about. And he did test positive for Lyme disease. But he didn't have they remember the tick bite. It was actually on the side. And he developed the rash up here. So it wasn't where the tick bite actually was. So.
This is a challenging section, lab testing for Lyme, which a few people mentioned. There's basically 3 types of testing for Lyme's. There's a Lyme screen, which is testing for a few antibodies that the body produces to fight the Lymes. And the accuracy of the screening test is around 50%. So we have a lab here, we do lab testing here. I don't do the screening test because 50% accuracy, you can guess at 50%. Why waste your money on a test? The next step up is the Western blot, which somebody mentioned a bit ago.
And I've had them too.
The Western blot is the one we recommend starting with. The reliability is better. It runs in the 65–75% range in accuracy. And then somebody mentioned that, okay, I had the Western blot, and the criteria of the CDC says it has to have 3 bands positive, and you only have 2 bands positive. What we have learned over the years is that there are some bands that are a lot more important than others. And so if you have 2 of the important bands that are positive, I can tell you from experience, you got Lyme's if you don't have 3 of them. So the CDC criteria isn't perfect, but it's just what they came up with a long time ago, and that's what they published.
We follow what the experts do, and I have never talked to a single expert in this field who follows the CDC recommendations. So again, the CDC recommendations, what it is, it tests 2 different antibodies, okay? Immunoglobulin M and G. It tests 10 strains of the G, which are gonna be typically, if the infections happen over 30 days. It's been over 30 days, then they'll show up more often. You need 5 out of the 10 to pass the CDC standards, okay? And then the other band they tests is IgMs, immunoglobulin M. And it tests 3 of those bands. And for the CDC, again, standard, it's 2 out of the 3 to be positive in the Western blot. Again, what if I got the IgGs and you got 4 instead of 5? Again, experts out there, they all follow that. They don't follow the CDC rules. They say, okay, that's more likely still Lyme disease. And then again, those certain bands like band 23 or 41, those are more common with Lyme. You might just have 1 or 2 of those, and those might be the way to look at it too again. So we look at it, you got to analyze it more than just what the CDC does.
And so the other thing, I just want to take 1 minute and explain when you're testing the Western blot, for instance, it's measuring antibodies being produced by your immune system against the Lymes. The Western blot is not testing for the Lyme's bug itself. So you can have somebody who has a sluggish immune system that can't produce antibodies very well, and they can have a raging Lyme's infection, and their immune system is not producing any antibodies. So their test would be negative, and they have Lyme's. I've seen it many times. So the testing, there's a next step up in the testing world, where there are a couple of labs that actually do test for the DNA of the Lyme's bug itself and the co-infections like ehrlichiosis, somebody mentioned. Those tests are more accurate, by far more accurate than even the Western blot. The difference is price. In our office, the Western blot is I think $150.
184.
184. So that's a price range. If you want to go up to the higher level where you're testing for the actual DNA of the bug, it's in the $400 or $500 range. So to increase the accuracy, the price goes up. That's what happens in the lab testing world.
Does insurance sometimes cover that 3rd test?
Yes
Yep,
and no.
sometimes they do.
Sometimes they'll cover part of it, sometimes they cover all of it, and it can be even more than that. Just for example, I had a patient who his Western blot showed basically negative, but he had all other symptoms of it, a weird rash. He'd been to his MD, he actually came to me first. I said, I don't know, it looks kind of like a spider bite, but it possibly could be a tick bite. And you got this rash that's not really, it's kind of following, it looked like almost a Rocky Mountain spotted fever, which is kind of associated with Lyme disease. And I said it wasn't getting better. And I gave him the option of doing a co-infection test, and that test was over $1,000. And he wanted to do it, and I said, that's your choice, because I think you have, because he couldn't get the treatment without that test being positive that he needed, right? And so when it came back, that test showed he had a co-infection, and it tested again for the Lyme's even more with the DNA and it showed up positive. That was the only time I've ever had a Western blot not show up how, correctly. That where I doubted the Western blot test and had to go on further screening. Now the antibody test, like he was talking about, I never do that one either. I've accidentally had that one ran by the lab company. They made a mistake and ran that one too, and it came back negative. And I'm like, no, you got to do the Western blot. You gave me back the wrong test, and then I get the test back, and they got Lyme disease, and even per CDC standards. So that test is very unreliable. The only reason I can see some places use it is in emergency room situations. For example, I've had a couple of opportunities where I've worked in overnight in the emergency room, and we had a little girl came in, and we figured she probably had Lyme disease, and we did the screening test because she's only going to be in there for an hour or two. So that's a fast turnaround test to get something back, for her insurance to say, okay, that's what she needs for treatment.
And which test was that?
That was more the screening test. That would be the only actually halfway decent reason to use that test is like an ER situation. But a lot of doctors think that's a highly accurate test. I just had a patient who came in, and we did a Lyme test, and it was a Western blot, and it was positive. She had the screening test done by her general practitioner, and they couldn't believe it. They're like, she went back and said, do you know how much this, again, when you look at the statistics, what percent failure rate is of that, false positives and false negatives with the screening test. And, her GP didn't have any clue. She thought it was always right, 100% of the time. So there's a lot of doctors out there that don't understand. And it's amazing. And I'll just tell one more quick story. I have another patient who has asked her doctor 4 times for the Western blot. Finally, she started doing it, and she's getting they still haven't ran it for her. She's been waiting over a month. And she wants that, her insurance is covering it through the other source, and I'm like, she's actually going to say, if they come back with it and not do it right again, I'm just doing it through you and paying the $184. I'm like, $184 for a month of being treated is worth it.
And the logical question would come up, why is it that if the statistics are perfectly clear, and these statistics come from the CDC and reliable sources on the accuracy of these tests, why would the clinics and hospitals run that screening test? And the answer is very simple, because that's what insurance companies tell them to do.
Mm-hmm.
Okay, if somebody comes with these symptoms, you need to do this test first. Why? Because it's cheap. It's $50 maybe, and the Western blot's $184.
Right.
So insurance companies says, do that one. And so what happens is that most people who work in systems, like, I won't name names, but local systems around here, they work in a system, they have a protocols, do that one first. It is useless in 90% of situations except like in ER. But why these things happen is for insurance companies to drive this stuff. What we do here, we don't treat the insurance companies, we treat people. And we do what will give us the best information to get the best treatment as fast as possible for the most reasonable price. That's how we do things.
So a quick question, are you able to, do enough testing, no matter which level it is, to say, yes, you have Lyme's, or no? Are you able to rule it out, you know what I mean?
Yep.
You're able to rule it out,
Yep.
or rule it in, okay.
I have a question about chronic Lyme's. Would the Western blot, would that pick up if you've had it for a long time?
Yes, it does.
It's got a really good chance of picking that up, yeah.
Okay.
And so, we can just talk about that briefly. What is the difference? And the reason why Lyme's is so difficult, somebody came in today and said, well, do I have strep throat? Well, we have a test for strep throat. It's very clear. You have it or you don't. Mm-hmm. And because strep bacteria act in a certain way in certain places, like in the throat, they know how they act, and there's a way to test it that's like 90+% accurate. The problem with Lyme's is a spirochete, and a spirochete is spiral shaped, kind of like if you have a bolt that has threads on it. If you took the threads off the bolt, and a spirochete is like a thread from a bolt. And what they do is they spin to move, whereas a bacteria has little tails that they move around in wherever they are. A spirochete actually can spin and screw into your tissues. They can screw into your joints. That's a common place they like to go. Why do they go to your joints? Very simple, because there's no immune system inside your joints. There's no blood flow inside your joints. So they hide in there because the white blood cells are mostly outside the joints. And so they go there to hide. Also, Lyme's, which a lot of bacteria have, they have life cycles. They have a period when they're active, they have a period when they're dormant, and then they also have what they call a cell wall deficient stage. So they have 3 different life cycles that we know of. And when they do that, your immune system knows who you are by how you look. So your white blood cells knows that it's a Lyme's bug because of how they look. If the cell wall is off of the Lyme's, then your immune system goes, it's just a blob of something, I don't know what that is. That's what the cell wall deficient stage is. And when it's in that stage, also, the different stages, the treatment is different. If they're in their active stage, like I gave my example of my son. When he was younger, he came home, tick was right there, and that evening he had the bullseye rash. I went to urgent care and got Cipro. I mean, if you have that scenario, antibiotics work, and they work quickly, and they work well, because you're getting them in the stage when they're in their spirochete stage. But if the Lymes have been there a while and they've changed life forms, antibiotics are worthless. They don't do anything to them. They can be in their cell wall deficient stage or their dormant stage and take all the antibiotics you want, and they'll lie dormant until a year later when your immune system gets down and you get tired, and they'll just turn back into their out form and you have full-blown Lymes again. So they are difficult bugs because they change shape, they change their cycle in their lives, and they can do it at will, and there's not any real rhyme or reason of it. They do what they do, and we don't have control over that. And it's not easy to find out which stage they're in. You have to do some work to figure that out, and you have to do treatments that work with that stage. And so we're going to get into treatment in a minute, but that's what we do, is figure out what stage they're in and what treatment fits that situation, because people are different and need different treatments at different times. And I learned this when I mentioned I started treating Lyme's a long time ago, and actually who I learned first about treating Lyme's was my neighbor, who was a veterinarian. And he was treating animals with Lyme's, and he said that he would do the test to figure out what stage they were in, and then he would use, like antibiotics, he would use antibiotic A for 3 days, and then antibiotic B for 3 days, and antibiotic C for 3 days, and then the next 3 days he'd go back to antibiotic A. And he would figure out what they needed and rotate on them, because like all bacteria, Lyme's become resistant to what you go after them with. So it's not easy. I just want to explain, it's a difficult subject to cover in a half hour, but we'll trying to explain why it's so complicated.
Does the stage affect how easy it is, or not, does the stage affect the diagnosis? Are you able to diagnose it regardless of the stage?
It's more difficult in some stages.
Okay.
Because when it's in its active stage and your body's producing antibodies to it, that's the easiest stage of diagnosis, because your body recognizes the spirochete and is producing a lot of antibodies, IgM and IgG that he was talking about. Then it shows up in the Western blot.
So is the advanced testing, is that able to, are you able to get a diagnosis with the advanced testing if it's not in one of those?
Yes.
Okay.
You usually don't have to do that really advanced testing.
Okay.
Like that $1,000, I think I'm the only one here who's ever done that test, and
I've
it
done
was,
twice.
or twice.
It's been a while ago.
Yeah, you know, it's not a very common thing, and it's usually, like I said, for a patient to really push for that, you know. Because honestly, the treatment wasn't any different for him, for his co-infection. The treatment's actually the same as for just the Lyme it was. But again, it can be, depending on what stage it's in, different, because, so like I had about a 15-year-old girl, and she's about 15, you know, she had a test done, she was positive for Lyme disease, she was over at her, again, GP clinic, and she was on 30 days of antibiotics, and she never felt at all better. And then, so we retested her here, just to see how active it still was. I mean, maybe she got bit by a new tick in between then, you know, so again, that could happen, but she doesn't, you know, that would be a little bit rare. And we retested her, still, all I think, I mean, in both of those categories, 90% of the immunoglobulins were positive still. And within 1 week of taking the stuff I gave her, she felt 90% better. After 2 weeks, she felt 100% better. So sometimes it's a combination too. Sometimes it's the antibiotics you need in combination with some of the stuff we give them. And sometimes it's just what we give you, or sometimes it's just the antibiotics. And the tests will usually tell us, you know, where you need to be with what type of treatment sometimes.
Do you ever have people who get worse first? I read about the.
It depends what you do, yeah, like Herx reactions. And again, if it lies dormant and it's chronic, things like that, there's things that can draw it out of you. Again, one of those things is possibly chemicals. You know, you're told not to, you know, put yourself into a small room with bleach, you know, bleach wash the walls, because if you've had chronic Lyme's in the past, it could get a Herx reaction or a reflare, because that can draw it out of your tissue and stuff.
I just had somebody, one of the last ladies I saw today, someone who has Lyme's, and she was taking things for it, and she was getting a little bit of a reaction, feeling sick the last few days, and we did a lymph treatment on her today with the system that we have here, and got her lymph system draining, because I could feel her lymph nodes were swollen here, and her spleen was swollen up a little bit, and we did a lymph treatment on her, and she felt much better when she left, because she was toxic from the Lyme die-off, which is called a Herxheimer reaction. But when we got her lymph system draining while she was here, she felt better right away.
So you're able to deal with that?
Yes.
reaction?
Yes. We tried not to have that happen,
Right, right.
but unfortunately, this lady believes in more is better. So she took these things and felt better, so she took more than I really recommended. I try not to encourage that, but some people do it anyway. But in her case, she was glad she came in today because she felt pretty rough in that reaction stage, but she felt good when we got a lymph system going. So these are just a list of some other co-infections.
One of the most ones you probably recognize is the Bartonella, Babesia, ehrlichiosis. Those are the most common types of co-infections.
There is an organization, there's actually two organizations of groups that create standards for treating infections. And the group that we ascribe to is called the International Lyme's Associated Disease Society. You can look them up on the internet, and they have protocols that they have designed and that are listed on the CDC website. The CDC lists protocols that they have deemed that pass the test for research and proven ability to work to treat diseases. And this group, their protocols are on the CD website. You can look it up if you'd like. They have met that criteria. So the things that we use, we're using the ILADS protocol. We do add some other things that we do. But those are the protocols, and they're in your notes. So they're listed here, and we have available all the things, pretty much all the things that are on there. Go back one. So, the other way. Oh, there it is. So it says on there, obviously, you know, get the digestive system working first. We always start there because you can get Herx reaction from killing off in your guts. You need to get sleeping for thyroid or adrenals off. That's something we do all the time. We just did a thyroid test on somebody just a couple hours ago. And detox, and this lady I just mentioned, and we do detox protocols. We use detox saunas, chelation, Myers cocktails. We also use ozone, which is an IV ozone. We also have antibiotics available. Dr. Peck, who works here, who's a nurse practitioner, can prescribe antibiotics if we think that's the best thing. If we have someone who's really sick and there are different stages, we can do antibiotics for a while, ozone, herbs, saunas, whatever we think, how we can get that cleared out in different stages. So that's all available here. And these are just some things, some herbal things that are known to be helpful. And there's ozone therapy, food sensitivity testing, heavy metal testing. And it mentions that the HERX is short for Herxheimer reaction. And again, the need to address all the 3 stages. Spirochete in that spiral form, cyst form goes by, and the cell wall deficient form. The cyst form is the dormant form that I was mentioning earlier.
And it's not like all these tests will always be done on every single person. You know, it's an individual basis. You know, it's not like we're gonna always do EKG on your heart. You know, more or less when people, because Lyme can affect people's heart condition. So that's a reason to do that then, to make sure it's not damaging the heart and stuff like that. So we do have an EKG machine.
And the reason the food sensitivity testing is on there is because if somebody is really, if their system is not functioning well and they're eating foods that they're allergic to, it really will affect them to the point where they just won't get better, even if they're taking the right Lyme's treatment. So I have had a few people that I've done food sensitivity testing on, but not most people. A couple of documentaries you can see, you can even see them on, you can buy these from that website. You can get them on Amazon. They're, I think, on, like the things where you get movies on the internet, I think they're on there also.
Netflix.
I think we even have a copy of Under Our Skin here also,
Yeah, we do somewhere.
if somebody would like to see those. So that's the end of the informative part, and the kind of things that we do, and we just wanted to, so this is, we kind of went through the slides. We just wanted to, what we do, we like to put out information to get people the treatment that they need, because it's frustrating for us to see people out there really a lot of suffering when we know there are answers to it. And so what we do is we have a standard offer. We have when we do our classes, we do them on different subjects, thyroid, a few different things. Is that if you're interested in what we do, we have a standard offer, an exam history, and a report of findings for $89 if you sign up tonight. And it's something that we explain some of the things that we do. We're gonna, I went a little over, we're gonna take a 1-minute break here, and then we're gonna open up to questions. So if anybody needs to get a drink, or you can do that, or we can just start with questions.
So that $89, does that include blood work?
It does not.
Oh,
We'll take a look at your blood work that you've had from before, or if we do it, then that would be extra. What we find when we do this is a lot of people have already had the test done, but their treatment didn't work. So we don't need to do the test over again, because the tests are all standard. We send our test to Quest Lab, which is the biggest lab in the country. So the testing is all standardized. But we have a lab here and we do the tests here.
But I just feel like I've been to the doctor all spring and summer.
Yep.
Would it be something where it would be good for a release of information to all of, like I've seen a rheumatologist, immunologist?
We'll say like labs for like the last year, so then we'll
Okay.
just get whatever labs you've had for the last year, and all that's, can be valuable information.
Okay.
And if we could see them ahead of time, it's helpful. Question?
I got all kinds of questions.
Okay, it's
Yeah.
question time, so go ahead.
Okay, when I was just in recently, I just read the book by Dr. Horowitz, Why I Can't Get Better, or isn't that the name of it, something like that? Why I
Okay.
Can't Get Better, right? And he says all what he's in that camp, that it's real,
Yes,
chronic Lyme's disease.
I've seen him on video, amazing
Okay.
guy.
Yeah. Well, anyway, the book was interesting. But, so when I went into the doctor this last time, and what happened was I made an appointment and I didn't rush it because I wasn't feeling that bad. Okay. because it comes and goes.
Yes,
And so, but I read this book, so I went in all loaded up with questions. And the first thing I asked him, I said, I've had it diagnosed 3 times. You've given me the same treatment. I feel better. So each time, is it gone? I said, so do you actually, is it gone? Well, yeah. I said, how do you know? You never test me afterwards.
I don't know.
You know? And so, I've had that happen 3 times. And I really trust my doctor, so it isn't that. And I realize they're under certain
They live in a
theories they have to live by, and
they live in a protocol world,
yeah.
and the protocols are, do the test, diagnosis, do the treatment, it's the end.
And I have to admit, I did feel somewhat better every time I
Yes.
took it. But it might be months, and all of a sudden, bang. And some of it happened in the middle of the winter. And it just got sick. I mean, so it's just, I
Most
just wonder why they don't test.
most doctors out there, first, they believe they agree that chronic Lyme's exist. Most do. There are some out there you'll run into that'll say, "Oh, that's a bunch of hogwash." I don't believe it. There are some out there that say that. Those are people are generally they just don't know what they're talking about because they are in the minority. Okay, by far. And is there a way? I don't know. To say, hey, you're 100% clear of your chronic Lyme disease. As far as I know, there's no specific or great test to say you got it 100% out of your system. How do you know there's not that one little bug? Because maybe you'll tell someone, oh, we got rid of it 100%, and then 5 years later they get a flare up. Now, did they get a bite that they didn't know about? Possibly. Or are they getting one of those Hertz reactions where it's coming back out again? It's just like telling someone who's had shingles, 1 in 3 people will get a flare-up of shingles. Now, let's say someone never gets it, does that mean they don't have that, the shingles virus in their system? No, if you've had chickenpox, you have it. It's just some people don't ever get that flare-up. And the same thing can be with that chronic Lyme disease, that you may never get a re-flare-up. But what we want to do is we want to kill those off to a point where it possibly can't flare up.
See, my point was, it isn't so much, I just don't understand why they start over every time. Because you go in and you got the same symptoms, or worse. I mean, sometimes they're really different. I mean, those people that have it, I mean, sometimes you're disabled almost for a couple days because you're just, and then sometimes it's just nagging. It's just, it's there for a while and then it's gone. But why won't they treat it? I mean, if you've been diagnosed 3 times, positive, I just don't understand why they just, well, it's got to be something else,
There's 2 groups, what I mentioned earlier, that there's 2 groups of protocols. The group we mentioned, the ILADS group, agrees and has proof that it's an ongoing issue that needs to be treated until it's gone. The other group is more cut and dried. Here's a diagnosis, you take this for this long and the treatment's done. Will it come back? They don't even think about that. You know that it does, and because it can switch back from those 3 stages of life that were on the slide, the cell wall deficient stage, the cyst stage, and the active stage, they can be cyst stage for a year and just sit there dormant until they come back out again. And the cyst stage can go back to the active stage a year later.
So this is what's so ironic about this whole thing is that last winter, winter before, I ended up in emergency with this huge pain in my chest. Well, first of all, I thought I had a heart problem. So they went in and they tested me. Well, I was in there about 10 hours. They couldn't find anything, And then they narrowed it down to pleurisy. Okay, so I asked them, well, how do you know it's pleurisy? Well, we really don't, because there's no test for it. But it's process of elimination. They said that, but then 2 doctors said, but you really have history in Lyme's. So we really couldn't rule that out, okay? And so here again, I go back in, after this, and that's not even a consideration. just, I know I'm doing all the talking here. But I just want to say this one thing. But I went in, they told me, the doctor believes I have these symptoms. Okay, so he said, but the test doesn't say it's that you have active Lyme. So you could see a disease specialist or a rheumatoid allergist. I said, well, I want to see the disease guy. Okay, so they called me, they sent all the stuff to him. I got a call today that he doesn't really want to see me. He just wants me to have another blood test. Well, I just went in there today, they took 9 vials of blood. And I have no idea what they're testing. But the nurse said, well, it's nothing real serious, but they think it's multiple things that could be causing these reactions. Okay. So, I don't know, that's why I'm here. But I just don't know what that's gonna do. You know, hopefully,
And the tests will only go so far, we
Yeah.
talked about.
yeah.
And when I first started in practice, this is a good example of what I'm talking about. When I first started in practice, I started seeing people with thyroid problems 35 years ago. And I ran into a lady that did the test and it didn't really show exactly what we were looking for, and she still had the symptoms. And at the time I was in Chippewa Falls, and there was a guy who was retired who worked part-time in the emergency room at St. Joe's. And I knew this guy, and he was probably late 70s, 35 years ago, so he's not around anymore. So I talked to him and I said, what do you think? And he said, well, I'll see this lady. And he said, this is what I would do. I would examine her and take a history. And so he did that, and then he prescribed thyroid medication. She was much better. And so I talked to him and I said, you know, according to the standards, and she had been to other doctors, and they said, well, your tests are fine, you don't need medication. And he said, I started in practice and treated people for thyroid problems before they even had tests. He said, I don't treat tests, I treat people. The tests are a source of information, and they absolutely are a good source of information, but it's not the final answer. So sometimes you need to figure it out and do something, even though the test shows something negative, there's something there.
You need better treatment, is what
You
he's saying.
probably speak for most of us.
Yeah.
You know,
Well, it's just so
It is.
confusing.
It's-
It
It's
is,
really
yeah.
confusing why, you know, he wouldn't give me an answer when I said, so, do you believe it's gone? Well, I should say, he did give me an answer. Yes, it's gone. Well, how do you know it's gone? You know, when you don't retest and you can't, like you say,
oh, we can
it
always
might not always be there.
Yeah,
You know what I mean, where it's gonna show up.
because he probably just gave you, like, again, 20 or 30 days worth of antibiotics and said, that's good, because that's
Right,
all he knows.
right.
That's all
That's the
most of them
protocol.
know, that's their protocol. Not every doctor out there, that's not what all of them do, but that's the majority. Because all they've learned in school is there's a thing called Lyme disease, and there are tests for it. If you think someone's got Lyme disease, order the test for it, read what the test results mean, like 5 out of the 10 IgGs or 2 out of 3 IgMs. If you don't meet those criteria, then you're negative. If you do meet those criteria, you're positive. If you're positive, this is what they recommend. 30 days of antibiotics, see you later. That's all you get for treatment.
So
That's
does
all
a
most
clinic,
do.
or let's say Mayo or Marshfield, does that protocol come from the top? Do they
That
have
is not
doctors
even
that you
ran by
don't
the doc-
experiment with this stuff?
Those places aren't even run by the doctors. They're run by
That's what I'm
administration
saying.
for money.
So they just, yeah, I get it.
They follow
Your 15
protocols.
minutes of,
Right.
yeah. But again, I'm fortunate, I'm not very sick otherwise. I've never been very sick. But this is really getting to me.
So the lady I was telling you about who's had this test done 4 times, she's over, I believe, at Mayo here in Eau Claire, okay? So the first time she went in to did the screening test, she goes, I want the Western blot done. The doctor said, oh, the screening test is perfectly fine. She goes, no, I want the Western blot done. Then she goes, okay, I'll run the Western blot. She reran the screening test. She called her back up. She goes, you didn't run the Western blot? She goes, yes, I did. She goes, no, you didn't. I got the test results right here. It's the antibody or the screening test again. And she showed it to me, so I'm telling her all this too. And so she calls her back up, went into her doctor. Doctor's like, she goes, I want the Western blot done test. She goes, you don't need the Western blot test done. She goes, we did the screening test, it was negative. She goes, I want the Western blot done. Finally, after arguing with her, the doctor looked at her, this is honestly what she said, she goes, fine, shook her hand and left. Okay, and that was where we're like, I believe it was male, it was male or Marshall, but I believe it was male. So she left, and she got her test results back. She ordered the Western blot for lung cancer. She brought the test in to me, I'm like looking at it, and I think I showed it to you even. I'm like, look at this, it was a Western blot for lung carcinoma. I'm like, this doctor doesn't know what she's talking about. She's obviously never even done the test. She did, and she's telling you, you know, whatever. And so she wrote her a nice letter of being upset and